Today's topic is really dear to me because I truly believe it can positively impact your breastfeeding journey. I'm talking about antenatal hand express, or better, antenatal harvesting of colostrum. Let's see together what I'm talking about. Hi mamas, I'm Ilenia and I'm a midwife with a passion for education and empowerment through your pregnancy, birth and postpartum journey. Today we're gonna talk about antenatal hand express because I believe there is so much information about labor, birth and even breastfeeding, but there is not so much about this topic and is really too big not to share. The importance of this topic and this practice is truly underestimated, and I believe that every woman should be able to hand express prenatal before the baby is even born. You're gonna say to me, Ilenia, I don't have milk until my baby is born. And that's partially true. You're not gonna produce the true milk until your placenta is separated and until 3, 5, 6 days after your baby is born. But in the meantime and during your pregnancy, you still produce a type of milk that is called colostrum. Colostrum is the early milk, also called, is a substance that is similar to honey. It's kind of sticky and thick, and it can be quite hard actually to express or for the baby to suck because of this deep and thick consistency that it has. It is can be transparent or yellow in color. It is also called the liquid gold, just to highlight the handless qualities of this liquid gold. In fact, colostrum is the perfect nutrient for your baby in the first days of life. It is produced in small quantities because baby's stomach is small and baby is able to digest it very quickly and therefore to ask for more very quickly. That's also why babies want to feed a lot in the first days. Their stomach can just hold so much, plus they know that the more they suck, the more true milk they'll get in the next few days. Now, don't get me wrong when I say true milk. Colostrum, it is still milk and is the perfect nutrient for your newborn baby. It is rich of protein, fat and even anticorps to help your baby's immune system develop. So it is very important that baby gets as much as possible, and we can help that by expressing in the prenatal period, in the third trimester, in the last weeks of your pregnancy. There are so many benefits on expressing milk for baby. I told you some of them, but let's keep going. Babies that are at risk at hypoglycemia, for example, benefit usually from receiving extra colostrum. So babies that are born by mothers that have gestational diabetes or type 1 or type 2 diabetes, those mothers really should be encouraged to hand express before their baby is born. But also mothers that have an induction plan or have a cesarean birth plan, those mothers still need hand express prenatally because their babies might be more at risk of going to special care, and therefore they might be separated from mom for the first hours of their life. Therefore, to reduce the exposure that they might have to artificial milk, to formula, which is still a very good substitute from breast milk when this is not available, but we want to avoid or limit the usage of formula, especially when we can express colostrum. Also, there are situations that you cannot plan. Also, if you're having a very low risk pregnancy, you might have a postpartum hemorrhage and needed to go to theater or even to remove your placenta. I mean, there are going to be situations that you cannot plan where you might need to be separated from your baby, and you're going to be so thankful that you expressed a few mils of colostrum to be given to your baby by your partner or by the midwife until you can come back to your baby and latch your baby to the breast. Last but not least is a huge, great skill to have. In fact, it might be necessary for you to express even postnatally. Therefore, if you master the skill antenatal, it's going to be extremely easy for you to express postnatally if you need to top up your baby with express breast milk. Colostrum, in fact, as I said, like brings the sugars, baby sugars up, and also it decrease the incidence of jaundice, of your baby developing jaundice, meaning when the baby's skin gets a little bit yellow. And we want to avoid that. We want to limit the weight loss that babies is gonna have in the first days of life. So all good reason to hand express. Also, if you happen to have engorgement or mastitis, you're still gonna need to hand express your breast. So you still have plenty of time to learn the skill in your antenatal period when baby is not here yet. But you're gonna say to me, can I not just use an electric pump? Well, no, you can't, because with colostrum it's going to be quite impossible for the pump to drain it. Colostrum, as I was saying, is very thick and sticky, so it is quite impossible for the pump to get it out. Therefore, manual hand expressing is absolutely suggested. Are there contraindications to hand expressing? Yes, if you have, for example, a placenta previa, or if you have an elective section plan, as I was saying, for some particular reason, well, you want to avoid hand express until the day before or 48 hours before. This is because there is a small but still possibility of getting contractions from the expressing. You know, in fact, that nipple stimulation or hand expressing is one of the possible way to encourage labor to start. Therefore, to reduce this risk, if you have any medical condition, then you want to do it the day before or 2 days before your planned birth date. Or even if you have a low-risk pregnancy, we want to start doing it above 37 weeks. At 37 weeks, you're gonna start doing it once a day for 3-5 minutes each breast, and then you can increase up to 2-3 times a day up to the end of your pregnancy. It needs to be something that you'll enjoy, something that you care about, so don't stress too much if you can't do it as many times. As much as you can, the better. As many drops or mils of colostrum you can collect, the better. But let's see together how we can hand express properly. Now, the first rule is actually to be relaxed. We need to produce oxytocin. We know oxytocin is a very shy hormone. It comes when you are relaxed in a very dark environment and when you are generally surrounded by people and situation that you love. So you can go to do a shower before you're planning to hand express, relax on the sofa or on the bed, listen to some music, and even have your partner to do it for you if it's something that makes you feel comfortable. You want to massage the breast first, so starting from the top towards the nipple, and you want to do all the part of the breast. Remember, the breast is divided in 4 zones kind of, so you want to be sure that you massage them all before you start. So after the breast is nice and massaged, you can also do something like this, just to put a little bit of the flow towards the nipple. Once the breast is ready to go, you're gonna put your hand as a C shape around the areola. The areola is this brown part around your nipple that at the end of pregnancy can be wider and brighter to allow baby actually to see it at birth. Anyway, you're gonna put your thumb and your index in here, and then the rest of the hand to support your breast, and you're gonna press the breast against your chest, compress and leave, press, compress and leave, press, compress and leave. And you want to do it a few times. Not much might happen in the first times you do it, and that's absolutely fine. It's just to let the breast memorize this movement and to just kind of activate all the ducts that are around the breast. You also want to make sure that you don't go forward with the fingers. So keep your fingers in the same position for while you do it, basically. Now, if you see that something is starting to come, you want to be able to collect it and to be able to store it for your baby. So you can either do it with a spoon if it's easier, or you can get someone to help you to collect the drops while you concentrate on the squeezing. Or you want to use a syringe. There are actually 1 ml syringe that are purposely for express breast milk, and the midwife is going to give you cups as well to put, and then you can store the syringes safely and bring them in the day of your induction or when you go into labor. Anyway, you can either collect the milk as it comes out, or if it's easier, you can take this part of the syringe out, put your finger here or the cup and just collect the milk directly into the syringe inside as the milk comes out. Then you want to close it properly, whatever it is, if it is half a ml, few drops, whatever, put the cup and store it in the fridge if you're planning to do it again the same day. Otherwise, just store it in the freezer. And you want to put a label with the date and the time that you expressed that milk. So put breast for 3-5 minutes or until you're tired and until you're getting sore. How are you gonna store it? So, as I was saying, if you're planning to have an induction or a section the day after, then you can just simply put it in the fridge and bring it to the hospital where your midwife is gonna put it into the hospital fridge. If you are starting to do it at 37 weeks and you're planning to collect a lot or a decent quantity of colostrum, then you want to store it in the freezer. And you can either bring it in the hospital with a cool bag, and then therefore it can be put in the freezer again, especially if you're going towards an induction that it might even take 3-4 days. Or you can defrost it and put it in the fridge, and then you are hoping to use it in the first 1, 2, maximum 3 days from when you defrost it. That's all for this video. Let me know if it was helpful, let me know if it is a practice that you knew about, and I truly believe it's gonna impact hugely your breastfeeding journey. I've had mamas bringing in a few drops of colostrum from mamas bringing in 50 or 100 mils. Whatever it is, the right amount for you is gonna help so much your baby. Let me know in the comments what you have done for your pregnancy and if your midwife told you about this practice. As always, don't forget to like the video and to subscribe. I'll see you next video. Bye bye!